There's two main things that need to happen for you to successfully avoid having a hip replacement surgery. You're hearing cutting edge information here. It's my mission to help you avoid a hip replacement surgery so you can be healthy, active, and mobile and do all the things that you want to do in life. It's estimated that 20% or 1 in 5 people suffering with hip arthritis will have a hip joint replacement surgery at some point. In 2020, there was 498,000 hip replacements done here in the United States. And by 2030, it's estimated that that number is going to climb to 850,000. That's just 5 years away from the recording of this video. And in 15 years from now, in 2040, it's estimated that that number is going to reach 1,429,000 hip replacements done in the United States. There's two main things that need to happen for you to successfully avoid having a hip replacement surgery. Number one is you have to get the irritation in the hip joint down. And number two is you have to fix the muscle imbalance. Now I'm going to explain more on these, but the reason they're related is because to fix the muscle imbalance, you can't be in an irritated situation in your hip joint. So we have to address that first. Then you can do the exercises necessary to fix the imbalance so that you can have normal pressures going through your hip and you're not making the arthritis problem worse as the years go on. To get the irritation levels down, you have to understand about how the muscle imbalance works. There's muscles on the front and back of the hip joint. On the back, you have the glutes or the butt muscles. On the front, you have the hip flexors. And what happens in people with hip arthritis is the glutes get weak over time. There's a bunch of reasons for this, but just understand it at that level. If the glutes get weak, then the hip flexors compensate because you still need to walk around and do your everyday life and your hip figures out a way to do it. When those muscles in the front get too strong and dominant, it starts to pull the ball forward on the socket, creating extra pressure in a bad way inside the joints. And if that's how you live all the time, if that's how you move, if that's how you get up and walk around and do all your daily activities, your work, time with your family, then you're going to irritate your hip joint. And if you keep irritating your hip joint over time, the surfaces inside the joint change. You start to wear down the cartilage, you injure the cartilage, the bones itself on inside the joint will change, and that's what shows up as osteoarthritis on the x-ray. For most people, if you can get the irritation levels down in your hip joint, it can get to the point where you feel like you don't even have hip arthritis. In fact, you may have experienced this where you had a bad flare-up and your hip was hurting and you're already beginning to think that you might have arthritis, but you're kind of confused and you're thinking maybe it's hip bursitis, maybe it's tendonitis, maybe you have a labrum tear, or maybe there's some nerve problem. And you might be wondering all these things, but then you rest for a while, a day or two, or maybe a week or two, and then you feel better and it goes away. And then you're beginning to think, well, maybe it's something else. Maybe it wasn't arthritis. If this keeps happening though, you keep getting flared up over and over again, what tends to happen is the flare-ups last longer. Instead of a day, now you have 2 or 3 days that it lasts, or a week or two that it lasts. And then they become more intense too. It hurts a lot more. This usually leads people to visit the doctor one day, and when they get that x-ray that leads the doctor to give you the diagnosis of now you have hip arthritis, and then comes the infamous phrase of, well, it's just a matter of time before you need a hip replacement. You're gonna have to come back and see me here in a year or two. That's when it gets real for people, and they start to think, oh my gosh, I have hip arthritis. The doctor said, the x-ray showed, and now they're telling me that I need a hip replacement surgery at some point. This is dreaded news, but in reality, for probably 95+% of the people that come into the clinic here to see me and that work with us online through our hip arthritis recovery program, they're just really irritated in their hip. And if they don't have any major losses of motion, they have the potential to heal naturally, to calm it down and then begin to fix the muscle imbalance. Most people are freaking out because it hurts. It hurts to stand up and walk. It's stiff in the morning. It doesn't let you sleep at night. It's very concerning because if you move or bend the wrong way, it really hurts it. But once you do the right treatment and you get it to calm down, then it feels a lot better, and it gets to the point where you feel like you don't even have hip arthritis. So calming the irritation levels down is a major step that you have to go through. That's why it's the most important thing to start with. But it needs to be followed up by the second part that I mentioned here, is you need to fix the imbalance. There's no silver bullet that will address the problem. There's no magic stretch. There's no magic hand technique that I can do to adjust the joint or manipulate the joint and get it to not have arthritis anymore. It's more like, instead of a silver bullet, think of 100 BBs. We have to do one thing that gets you to the next step, where you do the next thing and then you do the next thing. It's a process that has to happen over time, and there's a lot of learning on your part that has to happen along the way in order for you to know how to handle that muscle imbalance. And if you go through that and you know how to handle irritation, because it's going to come up again later on, and inevitably people feel better and they start to do more, and then it gets irritated again, then you have to calm the irritation down so you can go back to fixing the muscle imbalance. But if you know how to do that, it's in you. You know it. It's up here. You know how to read your life situation so that you're not making the imbalance worse. Then you have a shot at real, long-lasting healing from hip arthritis, and you don't have to have a hip joint replacement surgery. Healthcare professionals out there just aren't educated about this. It's not in the research. It's not something that you can just go find research studies on and see that it's successful. This is new stuff that the medical industry is just not well aware of. To my knowledge, there's no research studies on this stuff. So you're hearing cutting edge information here. So they're not going to be able to point you in that right direction. They're going to, of course, offer you medications, injections, and if those don't work, maybe physical therapy. And if that doesn't work, then they'll send you back to the surgeon. And the surgeon's going to offer you a hip joint replacement, which there's a ton of research about, and we know that it kind of works. It kind of helps hip pain, but it doesn't fully solve the problem, because the muscle imbalance isn't being addressed. You have no idea how many people come to me who have had one hip joint replaced because that's what the medical system led them to, and it was hell. They went through a lot of bad stuff to recover from it, and yeah, they're overall a little bit better, and the surgeon would call it a successful treatment, but they're still in pain. They're still having problems, and now there are other hips bothering them, and they don't want to have that surgery again. And that's why they find us and end up working with us. The root problem is still there even after you have a surgery, because it doesn't fix the strength of the glutes and the position of the ball and socket joints. You have to do that on your own. You have to be guided on how to do that correctly, and that's what we do here on this channel and through our hip arthritis recovery program. This program has 3 major components in it that you can take advantage of. One is it's got a curriculum. It tells you exactly what to do to heal your hip arthritis, to go from not being able to walk, having pain in the mornings, stiffness in the mornings, fear that you're going to have a hip replacement eventually. It tells you all the steps in the curriculum, but then we've also got coaching. You get group coaching that's live with me and my recovery coaches, plus you get into a community of other people that are on the same journey as you, trying to avoid having a hip replacement and getting back to doing the things that they love to do. Learn more about this program, the Hip Arthritis Recovery Program, in the link below here in the description.